Okay, we are back with part 4 of the basics of the brain, blood supply to the brain, and cranial nerves. And if you're joining us for the first time, I'm just looking at my blog, my road to medical school, .blogspot.jp, if you want to have a look. So let's continue with number 51. Describe the cerebral hemispheres. So there are 4 lobes: the frontal, parietal, temporal, and occipital. The frontal lobe is for higher mental function, contains speech and language centers. The parietal lobe initiates movement and is involved in perception. The temporal lobe is involved in memory, hearing, and speech. And the occipital lobe contains the visual cortex. Next, number 52. Describe the composition of the diencephalon and where it is located. It is composed of the epithalamus, thalamus, and hypothalamus, and it surrounds the third ventricle of the brain between the right and left halves. 53. Describe the cerebellum and its functions. It is composed of 2 lateral hemispheres connected by the vermis in the midline. It is important for maintenance of posture, balance, coordination, timing, and strength of contraction of muscles. Remember that the falx cerebelli separates it into the right and left halves. Next, number 54. Describe the brainstem. So the 3 parts of the brainstem are what? The midbrain, pons, and medulla oblongata. So the midbrain, also known as the mesencephalon, contains the narrow canal, the cerebral aqueduct. The pons contains the cavity that contributes to the 4th ventricle, and the medulla is continuous with the spinal cord and contains inferior portion of 4th ventricle. Number 55. The lateral ventricles are separated by what? What's the name of the separator? The interventricular foramen. 56. CSF is secreted by what type of cells? Choroidal epithelial cells. And these are modified ependymal cells of the choroid plexus in the lateral, 3rd, and 4th ventricles. The choroid plexus consists of vascular fringes of pia mater covered by cuboidal epithelial cells. What is hydrocephalus? Hydrocephalus is an overproduction of CSF, which obstructs its flow and interferes with its absorption. This results in an excess of CSF in the ventricles and enlargement of the head. Excess CSF dilates the ventricles, thins the brain, and in infants separates the bones of the calvaria, skull bones, because the sutures and fontanelles are still open. 58. Explain the direction of the internal and external carotid artery. The internal carotid goes to the brain, and the external goes to the face. 59. The vertebral artery becomes what? The vertebral artery becomes the basilar artery. Number 60. What happens after the bifurcation of the common carotid artery? What does it split into? After the common carotid artery bifurcates, it splits into the internal and external carotids. Number 61. What does the vertebral artery stem from? What does it become later? The vertebral artery stems from the basilar artery. It becomes the basilar artery. The vertebral artery becomes the basilar artery, and it stems from the right and left subclavian. Number 62. The internal carotid arteries. What should we know about them? So where do they arise from? They arise from the common carotid arteries in the neck. And where do they begin? They begin at the upper border of the thyroid cartilage. It says here it has no branches to the face or neck, but I'm confused about that. I'm going to check on that. Where do they enter? They enter the carotid canals in the temporal bone, then pass anteriorly and medially. What are the terminal branches of the internal carotid artery? They are the anterior cerebral artery, the middle cerebral artery, which contribute to the Circle of Willis. And they're used to the posterior cerebral artery by the posterior communicating arteries, united to these. One thing when we're thinking about the Circle of Willis, we have to remember that the basilar artery and the middle cerebral arteries supplying the brain are not considered as part of the circle. Which brings us to discussing the Circle of Willis. What does it consist of? What arteries? So the Circle of Willis, also known as Willis's Circle, Loop of Willis, Cerebral Arterial Circle, and Willis's Polygon, is a circulatory anastomosis that supplies blood to the brain and surrounding structures. The Circle of Willis is a part of the cerebral circulation and is composed of the following arteries. Here we go. First, the anterior cerebral artery on the left and the right. The next anterior is the anterior communicating artery. So we have a cerebral artery and a communicating artery. Next is the internal carotid artery on the left and right. And last, we have the posterior cerebral artery, left and right, and a posterior communicating artery, left and right. So remember, we have an anterior cerebral artery and an anterior communicating artery, and we have a posterior cerebral artery and a posterior communicating artery. And in the middle, you have the internal carotid artery. Remember again, the basilar artery and the middle cerebral arteries supplying the brain are not considered part of the circle. Okay, let's stop here, and then we will continue in the next video.